Tonight, a pandemic pledge from the White House to Northeast Ohio.
COVID-19 is one of the most formidable enemies America has ever faced. We've got to work together, not against each other.
Federal help is coming to the Cleveland Clinic next week to help with the surge in COVID cases.
President Biden announced the military medical teams today. Sarah Schuckman spoke one-on-one with clinic officials about this dose of relief from Washington.
Today, I'm announcing our next deployment of 6 additional federal medical teams.
One of those teams is headed to Cleveland Clinic.
Sometimes a few people in those critical areas just to relieve the staff and to bring in one more patient. And is very important.
Chief of Medical Operations Dr. Robert Wiley says 20 U.S. Air Force healthcare workers will arrive at main campus next week. The team of 4 doctors, 14 nurses, about half of them with ICU experience, and 2 respiratory therapists will be on the ground for at least 30 days.
We decided to apply to help out the entire zone, and including the hospitals in Cuyahoga County, but also the surrounding counties, to see if we could decompress everybody a little bit.
The clinic worked with the state to apply for FEMA help to bring in more military resources on top of the National Guard members already deployed around Ohio.
They are not viewed as replacements for those resources, but an addition to the resources.
Staffing has been a struggle, as an NBC report inside the clinic's ICU showed. The hospital activated CDC contingency plans, allowing COVID-positive healthcare workers who feel well enough to come back after 5 days, not 7.
We still have over 900 caregivers out. And so these clinical people who are coming from the Air Force will help us staff at the main campus, help us expand our bed capacity a little bit and to take care of more patients.
Another thing that's helping, cases are dropping. Cuyahoga County saw an average 3,200 new cases per day a few weeks ago and was down to 1,500 this morning.
We started out very hot in terms of COVID infections compared to almost any other county in the United States. And so we're kind of first in and first out of the wave is, we think, what we're seeing now.
Are we starting to see a peak?
I think we've actually just passed our peak.
Now, Dr. Wiley says we are still in the window for hospitalizations to crest, with a week or 2 lag there. The state is currently helping other hospitals, though it wouldn't say which ones, apply for similar aid. The decisions, of course, for us are made at the federal level.
Sarah, you mentioned this in your story, but of course the National Guard already deployed here. Why not use them for some of these jobs?
Well, Dr. Wiley said today the Guard has been extremely helpful with everyday operations at its hospitals, but it has limited clinical capabilities. Only about 100 Guard members are trained healthcare workers, and they're already spread thin. So this will provide the medically trained staff that they really need right now.
Okay. Sarah Schuckman in the newsroom. Thank you.